Good afternoon, Dr. Sharma. Welcome once again to another session on brain health.
And good afternoon to you, Dr. Vasconcelos. Good to be back with you.
Dr. Sharma, today is October the 20th, 2020. And as we continue on depression, we know that depression is like a cancer. Its goal is to destroy individuals. What are the clinical signs and different types of depression?
So, Doc, we did talk about depression as a form of cancer in a unique way, and it's also a very subtle disease that might present without having the person be aware that they're truly feeling depressed. So, but there are some clinical signs that can point to that, and it's almost like an internal thermometer that people can see for themselves that if any of these areas are not right, it could be that they're having a depression. And some of the symptoms that they would experience are problems with sleep. And in depressions, people often wake up early and can't fall back to sleep. They lose interest in their usual activities. They feel a lot of remorse about things in the past. They dwell on mistakes a lot. They lose energy. Energy is a big problem in depression, even more than feeling sad. Sometimes they don't even feel sad, but just they feel tired. Then there's a lot of problems with concentration and memory. And in older persons, sometimes we may miss the diagnosis of depression and think they have a dementia. So it's something we'll talk about in the future when we look at clinical problems of the elderly. Problems with appetite, sometimes they often eat less, but occasionally eat more to feel better. And then we have the big one, which is the problem of suicidal thinking. So these are the clinical symptoms that would make somebody recognize to themselves that they are in a depression.
Doc, how do these depressions progress with or without treatment?
So in progression, without treatment, the last symptom that I talked about, that suicidal thinking, often is the end result. That the person may progress to a point where they don't want to live anymore. They start to have suicidal intention, which is really bad. Many persons may have thoughts of life not being worth living, but when it comes to an intent of harm, that is really serious, and that person should be in treatment. So we don't want depression to continue like that, but some depressions can progress for long periods of time with the person entertaining suicidal thoughts, but without even treatment, they continue and they don't go down the road of committing suicide. They live in a state where they're not at their best, half their best, quarter their best, but they continue to function as if they're okay to other people, but inside they know to themselves they're not at their best. And that's a chronic depression we call it persistent depressive disorder. Whereas, and that can go on, as I said, for many, many years. It's a chronic condition. Can even start in childhood and progress to late adulthood. And that's a very sad state of affairs. The major depression, which is the one that would require treatment, because without treatment, that course is very poor. The person for two or more weeks tend to have 5 or more symptoms of depression and become very, very, very slowed up to the point sometimes they go into a stupor. And without treatment, they may end their lives. So the course for the major depression is pretty bad. Then the other types of depression, which would probably require treatment of the underlying conditions. You sometimes see depression associated with thyroid problems or endocrine problems, or even drug-induced or related to diabetes. Now with the COVID crisis, we've seen depressions related to COVID infections. I've seen a few cases already, even among our health workers who uh, experienced severe depressions, and it's because of the virus affecting the way the brain is functioning. Many viruses we know that there is a post-viral depression that is syndrome that's commonly recognized. So these things will affect a person's ability to function well, think well, be able to do their job and live with their families well. So the course for most of these depressions are downward slopes. So long courses for persistent depressive disorder, where the person can function and but not at their best, or more sharp declines in a major depressive disorder.
Doc, it is so important for people to know, and something you emphasize a lot is just the signs and the diagnosis, and more so is for people to understand that there is help, and they might be in a situation where they have these thoughts. In the middle of a pandemic, a lot of people are losing their jobs, they're losing their income, they're going through difficult times. Naturally, it causes an impact on the mind and on people's lives. And so it's so important for people to know that in spite of the challenging circumstances we're in, there's always help. And so it is getting the right help from the right people like yourself, and for them to understand there is a treatment, there is a way out, and there is hope. Any final thoughts?
I agree with you that there is hope and that persons must overcome that negativity for seeking help for their brain problems. There's nothing to be embarrassed when our brains are not feeling well. The brain itself is difficult for it to recognize its own problem. So the individual who has control over the brain must reflect on the symptoms that are there in their body, the same way they would reflect on the pain that they're experiencing in their chest and worry that it may be a cardiac problem. In the same way, if their sleep is disturbed or their appetite is changed or the mood is changed or their energy levels are changing, these are the signs that could tell the person I need to go get a brain checkup.
Well, Doc, thank you very much for always dedicating your life to training, educating, and treating and serving. So thank you so much, and I hope to see you soon. God bless you, and stay safe.
Thank you, Doc. You take care too and be safe.